Yes.
And in particular, that involves you in the preparation of reports for potential fostering and adoption of children.
Yes.
And that would, those reports would be in relation to the health of potential adoptive parents, yes. And also of potential adopted children.
Yes.
Yeah. And I think you also give advice and sit on adoption and fostering panels as a medical advisor.
Yes.
Yeah. That was work you did during the pandemic, I think. Mm-hmm. And also, I think during the pandemic, you worked with an out-of-hours service at weekends.
Yes.
And that involved you, amongst other things, and going into care homes.
Yes.
Now, so the statement that you've given is from two distinct perspectives. Firstly, you have given a statement in relation to your late father, who yes. we're not naming, but your late father died on the 28th of December 2021.
Yes.
And he was a resident in a care home during the pandemic.
Yes.
And the other part of your statement relates to your experience as a GP.
Yes.
And there are certain matters in that part of your statement that I will refer to today, but as I think we've indicated to you, there are some of the more specialist areas that you have and can comment on that will be looked at by others in the inquiry, probably in the early part of next year. And certain of my colleagues will be in touch with you for further details about that. But I will ask you certain matters in relation to your practice during the pandemic. Now, can we turn to your father, if we may, first of all? In paragraph 6 of your statement, you tell us that your father was diagnosed with a particular form of dementia called Lewy body dementia in May 2019.
Yes.
And you set out in some detail the effects, the various effects that condition had upon him. And I don't want to go through those in detail because they're obviously very personal, and we will respect that. But the one thing perhaps that is important to note was that his memory remained relatively intact.
Yes.
You tell us a little about him at paragraph 7. You tell us that he was very independent. He wasn't a man who accepted help very easily.
Yes.
But pre-pandemic, he was able to go out for walks, and he lived with your mother. And I think you have a number of sisters.
Yes, 5.
5. Yeah. And pre-pandemic, but post his diagnosis, what sort of level of contact did you have with him?
Most of us would go in, say, once a week to visit. So they would have several visits a week, but just visits of an hour or two, for social reasons, really.
Yeah. And so far as your father's day-to-day care was concerned, who was the person or people who did that?
So he didn't require any personal care. My mum would be the main person who supported him emotionally and who would orientate him and support him through any hallucinations or delusions he was having.
Mm-hmm. Yeah. And presumably your position as a GP gave you some insight into your father's condition.
Yes.
Once the pandemic started and restrictions came in, again, your father was still living at home.
Yes.
And that, of necessity, meant that you were not able to have or give your mother the same, and indeed your father, the same level of support as you had been pre-pandemic.
Yeah, no visits allowed, so...
Yeah. Yeah. And it did, however, become apparent to you, I think once garden visits were allowed, that your father's condition had deteriorated markedly.
Yes.
Can you just explain how that manifested itself?
In the conversations with him, he was far more preoccupied with his hallucinations and delusions than previously. And when I'd kind of got enough information out, my mum, I realised that he was getting up at nights a lot, preoccupied with hallucinations, and they weren't getting much sleep.
Okay. Was
I don't wish to barrage your father's condition either. Are you able to give any indication of what his awareness was of his condition? You said his memory was fairly intact.
So he understood the diagnosis when it was given. In the early stages, he was able to reflect after a hallucination or delusion that it wasn't a hallucination or delusion. You know, I thought that was happening. And as time progressed, that became more difficult to separate for him.
Thank you.
Thank you. Was there any deterioration in his physical condition that you noticed at the time?
Not markedly. He was beginning to become more unsteady on his feet, but he hadn't yet started having falls at that point.
Okay. He was hospitalised in October 2021.
Yes.
That's right. And you tell us that having been hospitalised, the hospital where he was adhered very strictly to the restrictions on visiting, but you were allowed essential visits.
Yes, so essential visits at that time were interpreted by the hospital as 2 30-minute visits a week by a named visitor. And we were allowed window visits, but the window was very high up, so we had to bring a stepladder for my mum to climb up, and then they couldn't hear each other because it was a wee crack in the window that was opened, so that was quite scary.
Yes. And in this, can you just indicate what it was that permitted you to be an essential visitor?
Because he had dementia.
Okay. And that was the policy that being adopted by the hospital, that if someone had dementia, then there would be an essential visitor.
They were happy to accept that when it was highlighted that that was necessary.
Yeah. Was there a single essential visitor, or did you spread it between the family?
We were asked to make it a single person and not to change it too often, so myself and one of my sisters we swapped it between ourselves, say, every few weeks.
Right, okay. And also, I think during this time you were able to have online Teams meetings so that you could be informed about your father's condition and you could ask questions about your father's condition, presumably.
Yes, that was the normal practice of the hospital, was to have a weekly ward round, and that moved to Teams once the pandemic started, and it was their policy that relatives could join that weekly ward round for their relative if requested, and with it moving to Teams it meant it was so much easier, so I basically joined every week for their meeting when they were talking about my dad.
And I think, excuse me, I think matters progressed, and forgive me, Mrs. Ford, I think I may have said that your father was hospitalised in October 2021. It was 2020.
2020, yes. Yeah.
My apologies for that.
I didn't pick up.
A decision was taken that it would be best that your father be cared for in a care home.
Yes.
And who was involved in taking that decision?
So the team around him would involve a consultant and nurses, special mental health nurses, physiotherapy, and myself. So it was a kind of joint decision. And social worker, sorry.
And I think you visited a number of care homes and eventually decided on a care home called Deanfield Nursing Home.
Yeah, when I say we visited, we only had the opportunity to have a walk round on FaceTime or WhatsApp. We weren't allowed to physically go in the building.
Right. And one of the things that was determinative of that care home was that it was quite close to your mother's home.
Yes.
Now, your father moved there in late March 2021. That was the year that he moved there. And you had put in place, really from the outset, a device which you talk about in paragraph 13 and indeed in other paragraphs of your statement, which enabled you to, as it were, drop in on your father, or members of your family to drop in on your father. Yes. Can you just tell us a little bit about that, please?
So I found out about it on the Care Homes Relative Scotland Facebook page. Other relatives had found out and were using this. It's called an Amazon Echo Show. It's a kind of iPad-sized device, and you can set it up in such a way that you can automatically appear as opposed to the person having to answer a call, which was ideal for my dad because his processing at that point would not allow him to answer a call. So it didn't require a staff member to be there and answer a call or help him with it. So we could just appear in his room on the screen.
And what benefit did you find from that?
It was a huge benefit. It helped my dad in the isolation period. So he was having frequent conversations with members of the family when he was having to stay in that room. My mum was having frequent conversations with him. And we're also able to see what was going on in the home a bit as well.
And presumably, because of your father's condition, you would be able to see your father at in various states, if I can put it that way,
yes.
that he would be presumably on occasions quite normal and on other occasions quite distressed. I think you make that point.
Yes, he never, he always recognised us when we turned up on this device. He knew exactly who we were, which daughter it was, but he would be in various states and sometimes be quite actively hallucinating and want to talk about that. Sometimes he was calm, sometimes he was agitated.
And did this also give you and your family an opportunity of, I won't say spying on your father, but you could see your father, and if he were in a distressed state, would that allow you to contact the care home to inform them of what you were seeing?
Presumably yes, but we couldn't get through to the care home on the phone.
That's the
but
point
yes,
I'm going to make, yes.
There were occasions when we felt it was quite important that a staff member went to him.
But I think, as you say, you had difficulty communicating with the care home. Why was that? Was it just not an answer?
They just didn't answer the phone. It just rang out.
Okay. And you had a power of attorney, I think, in relation to your father. But you say that there were occasions when you were not really involved in decisions about your father, albeit that you had that power of attorney. Could you just explain that a little, please?
So, although my dad's memory could be quite good, he still needed support with decisions. His ability to make choice was taken away when he was put in that home. He didn't want to be there. So it was deemed that he was not capable of making certain decisions. Therefore, any medical decisions or other decisions around about him should have been run past me. And I'd often go to the home and find that something medical had happened or another decision had been made and they hadn't talked to me about it. So I wasn't able to exercise that right for my dad in terms of consent for things.
Did you make any representations to the care home about that?
Frequently.
And what was the response?
There was acknowledgement, yes, absolutely, and then no follow-up. So there would be an agreement, yes, that was my right and that was the right thing for my dad. But you'd go back in and find that it still hadn't happened. So there was always it's probably the easiest way to just say yes and then not do the thing. So that was what my experience was with my dad, that they would agree and then not follow through.
And were there occasions when that was particularly significant in your assessment of your father?
Particularly around an episode of his illness. Later on that year, he had a bad period of illness, and I think on one particular night they phoned for NHS 24 when he wasn't feeling well, and it was very clear on his care plan that I should be phoned at that point in time, but they didn't. They phoned NHS 24. The NHS 24 flowchart triggered an ambulance to come out. Now, because of the echo show, my mum did know this was going on because she'd dropped in and found out, so she phoned me and told me, and I managed to get in contact with the home by the time the ambulance crew were there. They had wanted to take my dad into hospital. It was my assessment that he didn't require to be in hospital and it would be disruptive to his care and his well-being to take him into hospital. And that was a bit of a debate. I was pretty upset that if I hadn't found out through my mum that would have happened.
Yeah. And just for the record, you refer to this at paragraph 51 of your statement. I think there was this thought that your father was having a stroke. Yes, the
paramedics felt that his dizziness and his high blood pressure could be due to a stroke. I knew he wasn't having a stroke, even from looking at him over the phone. There was no symptoms of stroke.
And obviously the context at that time was that had your father been taken to hospital and then returned to the care home, he would have had to isolate.
Yeah, for another 14 days.
For another 14 days.
Yes.
And your intervention prevented that happening.
Yes.
Okay.
Presumably could only have happened by chance. You were medically qualified.
Yes. Yeah. Other relatives didn't have
Well,
that.
the paramedics would presumably have ignored anything that a layperson said. And justifiably, I may say as well.
And I think they were working within their realm of expertise.
Quite.
And I understand that. Yeah. But it was very clear in his care plan that I was to be phoned.
Yeah, I understand that. That's a separate point. That's a different matter.
Yeah. If we go to paragraph 21 of your statement, and we're dealing there with October 2021, and you say your dad's behaviour dramatically changed.
Yes.
Can you give a little context to that? So
when we were having the drop-ins, we had a set time every day to do a drop-in, which was 2 o'clock, and over 2 to 3 days he wasn't there, which was very uncharacteristic for him. And when I did catch up with him, he was acting differently. He was quite disinhibited and elated, and I knew he wasn't well, mentally unwell, and I felt he was going to be a danger to himself and others. I knew the symptoms that were happening. I knew what was going on. There were other things that I don't want to go into in detail here, but essentially it was quite a difficult situation that I felt could have deteriorated in him being taken out of the home and back into a psychiatric unit. But he didn't require to be if the correct level of support was given. That required me to liaise with the psychiatry liaison CPN and the social work department to get the right level of support put in for him. We got an extra grant given and an extra nurse given to give him one-to-one support for a week or two until these symptoms died down.
And I think round about that time, the care home had to shut down because there'd been a positive COVID test. You don't know whether it was a resident or whether it was a member of staff.
Can't remember now, but essentially somebody had COVID in the home.
And you then asked for essential visit status.
Yes.
And that was denied.
Yes.
Do you know why it was denied?
The quote given to me was that Public Health had given them advice to not allow any visits, but the emails didn't acknowledge the request that it was an essential visit that I was looking for. It was a difficult communication, and we had a couple of back and forth emails, but it was consistently no, we're not allowed to give visits.
And that was coming from the care home?
Yes.
And as a health professional, how did you feel about that?
Very frustrated.
Why?
Because if I had been acting as a health professional, I would have been able to get an essential visit for my dad. If I'd been a patient, I quite often went into care homes and said, no, you must allow essential visits for this person. But as a relative, I didn't have that power, and I couldn't get anyone else to allow it.
Mm-hmm. And I think you indicated that you would do in your statement that the care home relied on or had refuge in quoting public health advice. Is that right?
Yes.
And again, what did you think about that?
I was frustrated because the care home, although Public Health were giving advice, it was down to individual experts in their field to decide what was right for their group. So, and I'm not talking about adoption and fostering, but I was making decisions for children in care based on their needs. I would take public health advice into consideration, but it wasn't the only factor, and I didn't feel the care home were taking their responsibility on of deciding on what the best needs for their residents were and their families. They were foisting responsibility onto Public Health. Public Health didn't know what the right bespoke arrangements were for each individual, and it wasn't the right decision for them.
So if I may put it like this, the care home were relying on advice or guidance given by Public Health, which, as you correctly say, was based on populations, not on individuals. And I infer that the care home did not seek any advice from an appropriately qualified clinician in relation to the individual, your father, and also, for what it's worth, back to what you were talking about earlier on, ignored the fact that you, not as a doctor, but as an individual, had a power of attorney.
Yeah.
And therefore were entitled, in fact, had the obligation primarily to take decisions in relation to these matters.
Yes.
Thank you, Lord.
Mr. Gill?
I think you summarised that in a sentence at the end of paragraph 24, where you say most, and you're talking about the care homes, were blindly following public health advice.
Yes.
Yeah.
Did it appear to you that it was a convenient way for care homes to act by saying Public Health has said this, and we are utilising almost a blanket ban on contact?
Convenient. I don't know why people make. I think it's because it's the responsibility. I don't know whether they felt out of their league, out of their depth, but they wanted to give responsibility to someone else. You take a lot of responsibility on when you go against a kind of directive like that and say, look, I believe for these reasons we should do something different. And I don't feel, maybe they didn't feel they had the knowledge, the support. I don't want to completely criticise them for what they did. Maybe they were out of their depth, but there was clearly a great reluctance to take on responsibility themselves and make decisions.
And you say in paragraph 25 of your statement that you had an interaction with the Care Inspectorate in October 2021. Could you just tell us a little about that, please?
So I phoned the Care Inspectorate to find out what role they could play, because I was very frustrated with who do you go to with this problem. I couldn't, there just didn't seem to be anybody that had power or influence in the situation. So I phoned the Care Inspectorate. They were very nice on the phone, but they said it wasn't really their role to get involved unless there was it was more to do with physical care and personal care, if he felt there was the care home was being negligent on matters like that, but that this was public health guidance and they couldn't really intervene with that. So they didn't seem to be a body that could influence care homes on this issue.
And therefore not a body that could assist you.
Yeah.
You also mentioned in that paragraph the interpretation of essential visit also widely varied, with many care homes restricting it to the last days and hours of life.
Yes.
Is that something you gleaned both from your involvement in the care home relatives group and also from your own experience as a GP?
Yes, both. I mean, there was lots of accounts on the Facebook page of some people being allowed visits, some people not being allowed visits, and being very restricted to that 30 minutes. As a GP, I frequently asked care homes to allow relatives to visit after I'd been to see someone. And there was reluctance, but they're not dying, and I say, but they might, so could you please let somebody in? They're not well, they need some support, that kind of thing. So yes, I did see that there was a wide variation, yet I'd go into other homes and they were allowing much freer access to relatives, I thought rightly.
Yes. I think you also were concerned at this time that your father's normal day was fairly boring, and however, he did want to sit in his room, as he was much calmer when he was in his room. Is that right?
Yeah, I think his illness found once he was out of a space that he was very, very familiar with, his hallucinations would get a lot more active. So he was calmer in his room, but his mind was still fairly active. He needed quite a lot of interaction. He wasn't able to entertain himself anymore, so he was a musician and he'd lost the ability to play his guitar. He loved listening to music, but he couldn't operate a device to play music for himself. So it would be our practice to play music with him or talk with him about things that we knew he was very interested in and he wanted to talk. So it was very bespoke for my dad. He just wasn't someone who would join. He never did join in big groups when he was younger. He wasn't going to join in big groups now.
Okay. So he's more a soloist rather than an orchestra player.
Indeed.
Okay. Right. Could we go to paragraph 33, please, about visits? And a lot of what you say in this section, Mrs. Ford, is material that this inquiry, albeit in a short period of time, has become very familiar with. And please don't think that we're ignoring what you say, but if I can just pick up a few points from that. I think one of the problems you highlight, and you really just talked about it, is that your father's mood could be very variable due to his illness.
Yes.
Yeah. And there were not certain services, there were certain services such as podiatry that he couldn't receive. He needed that.
Yes.
And paragraph 37, you say that his condition declined rapidly as the year went on.
Yes.
And were you able to see him during that period?
On and off. So that once the visits were allowed, we were initially allowed, say, one visit a week there was the garden visits, and then we progressed to visits in the room. And at some point, they were a lot freer. I think we were allowed 2 to 3 visits a week before restrictions came back in again over the winter.
Yeah. And you do say that in paragraph 37 that you can't definitively say that the restrictions on your father's visiting are directly attributed, could be directly attributed to his decline, but you say it did not help.
No.
Can you just explain that from your perspective as a practitioner?
I think, you know, my dad was very unhappy about being admitted to a nursing home. If we'd been freer to have a variety of family members going up at different periods in time, we may have been able to support them emotionally better. In particular, my mum needed the freedom to pop in. She often would have days where she wasn't feeling great, so if there was a set visit that day, she might not feel well enough to go.
Yeah.
But she would sometimes feel, oh, I've got some energy now, and she could have gone up and popped in because it was near. So I really feel that not being able to support him emotionally with family around him, which he's had his whole life, and then all of a sudden it was absent, he must have felt terribly abandoned. And I'm sure that must have caused things to deteriorate for him hugely. In
paragraph 40, you talk about the effects and the impacts on both your mother and indeed on you. Mm-hmm. And first of all, your mother, and you've made mention to her health, and you say that she felt guilty, frustrated and angry because she wasn't seeing him. How did she manifest that to you? How did she tell you about that?
She tried not to tell us, but she did tell us, and she was very often tearful and would get very frustrated about aspects that she couldn't help him with. Mm-hmm. So if in the evening she was on the Echo show and he was maybe trying to get ready for his bed and he couldn't get his jumper off, she felt really frustrated that she wasn't able to do that for him, and even more frustrated that she couldn't get a staff member in to help him with it because she couldn't get through on the phone. Yeah. So it was like she was going to feel emotional pain anyway at my dad's illness, but it was very frustrating for her not to be able to have freer access to him.
You describe it as grief.
Oh, yes.
And you also say that subsequently, and obviously after your father's death, she still is regularly in emotional pain as she recalls that time. Is that still the position?
Yes.
And also, you say that you could surmise, I suppose, that your father felt abandoned.
He told us.
Oh, right.
He told us very frankly.
You didn't need to surmise it.
You've just left me in here. You've put me to my death. Mm-hmm. You know, he was fairly expressive.
Yeah, he let you know.
Yes.
Yeah. And I think you say he blamed you for that.
Yes, he did see me as responsible for a lot of the decisions, which was true. But yeah, he kind of said, you know, he would quote and say, you know, family are supposed to look after family. You know, there's no reason why I can't be in my house. And I would say, well, I don't agree with you. So.
Yeah. You go on to tell us about events over Christmas 2021. And you mentioned that your father's, what you term, ceiling of care was to be in a care home, not to be transferred to a hospital.
Yes.
Yeah. And that was something that you as a family had discussed.
And my dad as well.
And your dad, yeah. Obviously the events over Christmas 2021 were very difficult for you, and we can read that. And you do say that the duty nurse was very good and pragmatic. That's yes. Paragraph 47. And your father slipped into unconsciousness and died in the evening of the 28th of December.
Yes.
Your family were all allowed to visit him in his final days.
Yes, they didn't restrict us at all, day or night, which was just...
And you also say that the home supported you and your family during his final illness.
Yes.
You mention do not resuscitate at paragraphs 49 and following, and I think we've already touched on this. That was in place for your father, and I think what you refer to in paragraph 50 is an anticipatory care plan.
Yes.
And that was a part of that anticipatory care plan for him. Yeah. And you then go on to talk about the incident that I think we've already talked about, when you were able to inform the paramedics that your father wasn't having a stroke. Some of the other points you make under impacts, obviously as a starting point, your father's illness was very stressful both for him, presumably also for his carers.
Mm-hmm. Yes.
And for his family.
Yes.
And you say it was made more stressful by the home and the restrictions. Do I take it what you're saying there is that it was made more stressful by the way in which the home operated the restrictions?
Yes. And
you are critical of the communication with the home. You say it was dire.
Yes.
Can you just give us a little flavour of why you say that?
It was during working hours, sort of Monday to Friday, there was an office, and you could get through to the home, and they would maybe try and pass a message on to the unit that my dad was in, and you might or might not get a call back. But in the evenings and in weekends, there was nobody in the office, so the phone went straight to the unit, and it was virtually never answered. And then I found out that they had a phone in an office which no staff were ever in, quite rightly, because they were out on the floor attending to residents, and there wasn't enough of them to go back. And I absolutely agree with them, they shouldn't be breaking off with caring for someone to go back and answer a phone. But a simple solution of having a mobile phone on you would have made the difference, but they didn't do that. On one occasion, my mum phoned me in a real state. She was witnessing a very distressing event over the Echo Show. She couldn't get through on the phone. I was working, and I tried 18 times to get through to that home to get someone to pick up. And eventually I just drove round to the home and spoke to them and said, there is something going on. And, there needs to be a way of answering. So I complained, my mum complained, my sisters complained. There was various, our phone system's not been working properly. There was never an acknowledgement that it was a system that just wasn't working.
Okay. And presumably, you make the point in paragraph 57 in your section on lessons learned that staff should have been supplied with mobile phones. They could presumably have been supplied with other means of mobile communication that they could have had on them.
Very easily. We found out later that one of the staff members was actually giving out their private mobile phone because they were frustrated that relatives weren't getting through. And I only found that out because I phoned it and they said, I'm at home. And I was like, okay, right, I shouldn't be using this number. And I can understand why they did it, because they themselves were frustrated at not being able to be communicated with.
One of the other points you make in paragraph 54 is that your father had no access to religion. That presumably was an important aspect of his life.
Before going into the home, yes.
Yeah. You, if I can put it this way, plug the Echo Show as a means of communicating. You found that obviously very helpful.
Yeah, I think it's a standard. It should be offered to all people going into nursing homes or residential care as a way of communicating. There's lots of ways you can make it work.
Yeah. Okay. Can I move on to your work as a GP during the pandemic, if I may. Mrs. Ford. As I've said, some of my colleagues would like to talk to you about this and get some more detail in relation to this, but I'd like to raise with you a few points. Paragraph 66 of your statement. You reflect, I think, on the early days of the pandemic, and from your perspective as a GP. And you say that there was a projection that hospitals were going to be rapidly overwhelmed with people sick with COVID. And this was based on, in part, I think it should be, on the experience of other countries. Now, decisions, as you go on to say, were made to discharge as many people as possible, particularly elderly people, to any spare beds in care homes. And you go on to say, I believe this decision was made to clear space in the hospitals, but also to try and protect those elderly people, as it was becoming clear that many people, and you mentioned both patients and staff, in the hospital had COVID. You conclude, sadly, many of these elderly people also had COVID, therefore accelerating the spread of COVID in the care homes. Now, I think that that's something that probably we have all generally heard about, but you're telling us this from your perspective as a GP. Can you just give us a little more detail about that, how this information came to you and how you formed these impressions?
Well, I'm sure everybody remembers the beginning of the pandemic, and we were watching on the news the scenes from Italy and what was happening in the hospitals there, and they were completely overwhelmed and staff were massively overwhelmed, so we were trying to learn quickly from them, and I do believe that's why the decisions were made about clearing the hospitals. The projections were that we were going to be utterly overwhelmed, and we knew that older people were particularly vulnerable to this disease and that it was going round the hospitals. So it made sense to try and get them away from the disease. There just wasn't the foresight put in that they might then carry it into the care home. It was just not joined up thinking. Mm-hmm. So in retrospect, it was a really bad decision, but I believe it was made in the interests of the population and elderly people.
Can I ask you, please, in your capacity as a general practitioner, talking about the very early days of the pandemic, and if my recollection is correct, we're talking about mid-March, possibly early March 2020, when you're perfectly correct, we saw photographs of, I think, care homes in Bergamo, in the north of Italy, as you say, overwhelmed. You said in your evidence to Mr. Gale a minute ago that we knew that the elderly were, can't remember the exact words, but were vulnerable or most affected. How did you know that in those early days? And you're speaking as a GP now.
Yeah, because the patients that we were seeing, and it was February when we were starting to see unusual symptoms in elderly people. I was doing home visits and I was seeing this strange pneumonia that was causing oxygen levels to plummet. And shortly after that, the person would have died. But they didn't seem particularly sick when I was examining them. It didn't seem to add up. So we knew that this group was particularly vulnerable, and then I think there was a care home in Lanarkshire that was affected, and within a rapid period of time, over 18 people had died in the care home. And we were quite terrified. We thought, oh my goodness, this is just going to rip through the whole of our population, and elderly people are not going to have a chance.
No, that's very clear. Thank you very much indeed. Yes, Mr. Gale.
Thank you, my Lord. You offer some praise in paragraph 67. You say, we did a fantastic job responding to the initial challenges of the pandemic. Who's the we?
Everybody who had a role in trying to create a service. So the community response to, in the health service based and care staff, everybody tried to do their very best to come up with a plan that would keep the risk as low as possible. We created a community response to answer people's queries. We created a phone line. We created centres for people to be seen if they needed to be examined that was safe and away from other places. The hospitals got themselves ready very quickly and I believe dealt amazingly well with the response.
And of course you were dealing with a rapidly changing situation.
Very.
You make reference in paragraph 75 of your statement to using your own infection control knowledge.
Yes.
And I'll come back to paragraph 72 in a moment, but just on that, why was it necessary for you to apply your own knowledge of infection control?
Because it would take a week or two for there to be policies drawn up. So once we saw the evolving situation going on, I did home visits, and in our home visiting car, it wasn't our normal practice to sterilise the car, wear gloves, aprons, going in and out of people's houses for day-to-day, visits. And we immediately started realising that we were going to have to change our clothes, sterilise everything, wear masks. We were doctors, we had a bit of knowledge about how viruses spread and that this virus was an unknown. So we acted immediately. We didn't wait for any policies to be drawn up or get told how to do it.
Yeah. Just going to paragraph 72, if I can go back. You mentioned a little there about PPE. And in particular, you mentioned the FPP3 mask, which was recommended by Public Health. But as you say, very few were available. That was your experience at the time, was it?
I never saw one.
You never saw one. Okay. And the guidance then changed to depart from the need for that sort of mask. And you have a reason why you think that may have happened.
Yes, I think we were all very mistrusting of the guidance changing in the light of that there wasn't enough supplies to go round. So the initial understanding of the virus was that the best way to prevent infection spread was to wear an FPP3 mask. And then evidence came out that that wasn't necessary, but it coincided with the knowledge that there wasn't enough masks. Mm-hmm. So we were quite suspicious of that.
Yeah. You also note that there was a recommendation for use of hazmat suits.
Yes, that's right.
You say that was out of the question. Well, from a practitioner's point of view, tell us why it was out of the question, please.
Because I think we probably had one in each car, but nothing to replace it. There was just no supplies.
Okay. Would it have been something that you would have been comfortable wearing and using if needs be?
Probably not, but we were so frightened at that point in time that we didn't, to go in without it, when I was, so when the nurses were coming round to do the swabs at that stage, they were fully dressed in hazmat suits, FPP3 masks and eye protection. But then as a house visiting doctor, I was told it wasn't necessary. And you think, well, why are they dressed like that? And I have to go in for someone who I know has got COVID and not be dressed like that. So it was, I think I would have worn it and then got very fed up of it, but I was frightened not to be having the option.
Okay. Can we go to paragraph 83, please? And I am deliberately skipping over the section on adoption and fostering, because that will be dealt with by others in the inquiry, and we'd ask you to give further information about that. We're going to paragraph 83. You have a short paragraph there about care homes during COVID and your out-of-hours service that you were providing. and you tell us that you visited care homes and care home residents, and you also volunteered for what you describe as the COVID shifts. What were they?
So the COVID hub was the name for our response in the community to the pandemic. So in order to separate patients who might be suffering from COVID from other illnesses, the out of hours set up a specific service within out of hours to deal with patients with suspected COVID, either over the phone for advice or face-to-face in a centre or on a home visit if required. And this was streamlined into COVID shifts. So I would do a COVID shift or an out-of-hour shift, so I knew which group I would be seeing. So in a COVID shift, I would be visiting people with suspected or confirmed COVID.
Yeah. And that could be in the community or in a care home?
Yes.
Yeah. And you say in the last sentence of paragraph 83, you visited many care homes, and in the initial weeks of restrictions, they were in chaos.
Yeah.
Can you explain how you came to that view?
So different care homes had different arrangements to try and respond to this situation. Some care homes were trying to restrict their residents to certain areas. They were trying to separate the care home into an area where residents had COVID and those who didn't. There was plastic sheeting pinned up in places in some care homes. The staff were overwhelmed, really kind of at sea with how they were supposed to be responding to this. The nurses in particular were very overwhelmed. When COVID broke out in a care home, within hours, days, several residents would be showing symptoms, and you had one trained staff nurse who was supposed to be going round and dealing with all of the sort of medical care. The staff themselves were frightened. Many were going off sick themselves with COVID or were having to shield. Mm-hmm. So it felt awful. It felt a really abandoned group of people.
You make those points later in your statement. We'll come to them. But just possibly a point to take now. You're saying that staff were frightened. Were you frightened?
Very early on, yes. But that kind of dissipated into concern quite quickly.
Mm-hmm. Okay. Paragraph 86, you make an interesting point about the average level of life expectancy of someone who enters a care home. And can you just tell us what your understanding is of that life expectancy?
Yeah, so once you're of a stage in your life, when you're getting older, that you need the level of care provided by a home, on average, the life expectancy is around about 2 years. So it is the end stage of your life. And most people entering a care home are frail, which is a medical term. Yes. To describe their physical state and the type of conditions they will rapidly deteriorate when they have an illness. So in terms of things like CPR in the event of a cardiac arrest, it is highly unlikely that a frail elderly person would survive CPR. Mm-hmm. And generally, when you go into a care home, a DNA CPR certificate is issued, but it's explained fully as to why this is advised. And
presumably would be discussed with the family and with the resident if the resident was capable of entering into that discussion.
Yeah, it's usually a fairly gentle, slow discussion that everybody gets to understand and take on board and actually see, that's the best thing for me, my relative.
And I think you say that your experience was that once explained, that was something that a family would rarely refuse.
Yes, if it was explained properly and they understood that it wasn't you're stopping treatment in the event of illness, you're just not going to attempt a resuscitation in the event of cardiac arrest. It's a difference.
Paragraphs 91 and 92. Again, this is something that we've heard on a number of occasions, Mrs. Ford, so I don't want to go through it in great detail, but you do make the point that care homes rely on family members to provide emotional support and company to the loved one, so they're an essential part of that care.
Yes.
Yep. And you say, obviously, I think you mentioned bespoke arrangements earlier, that obviously it's a family member who can tell the care home what the resident particularly enjoys, is familiar with, understands.
Yes.
Yep. And you indicate that, as you put it in 92, the sudden exclusion of families, non-essential staff, and third sector was very obvious when you made your visits.
Yes.
Yeah. Just give us a little flavour of that.
So, prior to the pandemic, visiting a care home, many of the residents are sitting with family, they are chatting, there's laughter, there's maybe a concert going on in another area, there's lots of events. It doesn't feel like a hospital, which is not meant to. It's meant to feel like a home. And there's a kind of noise and hubbub.
Yeah.
When the pandemic started, that it was deathly silent, apart from residents shouting out in distress.
And you reflect that there was distress on many parts. There was distress of the residents, the distress of families, and distress of staff.
Yes.
And I think you conclude in 92 with a statement, they seemed overwhelmed and not in a good place. Yes. You have sections on sedation and end-of-life care, and we obviously have those, and we will have regard to all of that. But can I take you on to your impact section of your statement at paragraph 120? Because I think essentially you set out you summarise your views on what happened, and I think you reflect on yourself that you were mentally and physically burnt out.
Yes.
Was that as a consequence of your work and the concern for your father?
Yes.
And would you just read paragraphs 121 through to 124, please?
Sure.
Inclusive.
The impact on care homes was terrible. The atmosphere was desolate. Staff and residents were equally distressed. Dementia in patients was accelerated due to the isolation. I saw this firsthand with my dad and other residents who I was visiting. Residents were lost and unsettled. The atmosphere was bleak and desolate. Residents were barrier nursed in rooms with an infection control station outside. Because of COVID and the neglect of family involvement, very often DNA CPR conversations were not taking place with the family, and they were shocked to find out they'd been put in place.
And in paragraph 125, you refer to care home residents as an abandoned group of people. I think you've said this earlier. Who were they abandoned by, in your view?
That's a really difficult.
If you don't feel you can answer it, then please just say.
I guess because they were not knowingly abandoned. It's, you know, the thing with abandoned group of people is that everybody thinks that somebody else is looking out for them, and there wasn't anybody with power looking out for them or the ability to make change. So I'm not sure who was responsible, probably many people, but not knowingly, not deliberately.
Okay. We look at your lessons learned at paragraph 129 and following. Now, I hope I made clear that I had adopted, but with your permission, what you said in paragraph 129 when I made my opening statement in this inquiry, because I felt it was a very simple, if I may say, but very pertinent observation. Could you just expand on it just a little? How you felt that the soft stuff is important and that the focus was on the hard stuff?
So by the hard stuff, I mean the population-based decisions that needed to be made to keep as many people as safe as possible. And there was a big focus on that. And then when it got down to the actual emotional and spiritual care of individuals, that was shelved for far too long. So, you know, it was fair enough in the first week or two that we didn't think about how we were doing mentally or emotionally, but it went on for months and months and months, and it just never seemed to become a focus, and it caused an awful lot of damage.
Yes. You take that on, I think, in paragraph 130, where you're talking about the guidelines and that they were guidelines and not rules.
Yeah.
And you say, we knew the impact on residents in April 2020, and the isolation went on far too long.
Yeah.
Could you understand perhaps the reason why the isolation continued?
Of course. You know, we understood that we were trying to keep people safe, but there was, at that point, needing to understand that there was more important things going on for certain groups of people that needed to be taken into account.
Yeah. And you praise Care Home Relative Scotland for the work they did. And I think that you said right at the beginning of your evidence that it was their Facebook page that got you to the Echo device. Yeah. Yeah. And you also praised the campaign for Anne's Law.
Yes.
Yeah. As a practitioner, do you see Anne's Law as currently suggested by the Scottish Government as being an adequate process to have in place?
I don't think it goes far enough from what I've read. I think it's still fairly restricted into one person and putting the burden on one person being this access point. There's not, you know, you have different staff doing different shifts in homes. Why can't you have different relatives doing, you know, different visits? So I don't think it goes far enough.
Yeah. And I think, again, a point you've perhaps alluded to earlier, you reflect on your fostering and adoption work and the role of lobbying on behalf of care experienced children and their families. And I think you suggest that there should be some group publicly funded on behalf of care home residents to advocate their case.
Yes. As a medical advisor, the social work department came to me to ask me what I thought of how do we arrange contact between birth parents and families, and I had knowledge how to do that safely from an infection control point of view, but I also had knowledge of how important it was to support family contact time. And a similar group needs to be, we need to have medical knowledge, but we also need to have people with specific knowledge of the emotional and spiritual care of people in care homes. It needs to be multidisciplinary to make decisions.
Your final substantive paragraph, other than telling us when you were on holiday, is a wider perspective, and presumably, again, but based on your experience as a GP. Just read that out, please.
133.
133.
So greater consideration and provisions need to be made for homeless people, looked after children, domestic abuse victims, asylum seekers and the elderly, who were massively underrepresented.
Now, Mrs. Ford, having gone through your statement in the way that we have today, is there anything that you particularly feel that you want to emphasise to us?
Nothing further. I think I've kind of said it. There are vulnerable people, and this mustn't happen again. If we do find ourselves in the same situation, we need to have things in place that protects groups of people who can't speak for themselves.
Now, before you finish, Mr. Gale, I've got one question that I would like to ask Dr. Ford, and it may sound a very obscure and odd question. I apologise for that, but there is a purpose for it. You said a long time ago at the beginning of your evidence, or close to the beginning of your evidence, that on, I think it was at least one occasion, possibly more, that because, I think when your father was in hospital, but because of where his room was situated, it was necessary to use a stepladder to communicate or see him. Now, you may or may not be surprised, but we've actually heard that evidence, or very similar evidence, from other people already in this inquiry more than once. There may actually be something which I have to have regard to in relation to things like use of stepladders. Can I ask you this question firstly? You said a stepladder, which again is a vague term. To gain the access you required to see or speak to your father, how far up a stepladder did you require to go?
So it was mainly from my mum, who at the time was 83.
I was about to ask. So she was elderly.
83, and the window, although it was a ground floor, she would have, like the top of her head would have come to the bottom of the window, and the crack to here was up at the top of the window. So in order to maybe to try and hear each other, we thought we'll try a stepladder. So she probably went up about 3 or 4 steps. It was a kind of tripod type stepladder, and got her nearer to the window.
So not too high, but nevertheless for an 83-year-old lady probably rather more off the ground than she might have wanted to be.
Ridiculous.
All right, that's, I wouldn't have used the word, but I'm glad you did. Thank you. But the serious point is, I think I infer from what you've just told me that you decided that was the way to do it. The hospital, because it wasn't a care home, but did the hospital know about this?
They probably didn't know about it, but they knew that the window was too high for us to hear him properly. It was better than piling bricks up, which was our first solution, because there was some bricks there, but so we thought a stepladder was safer.
Perhaps the question should better be framed this way then, in the knowledge that it would probably be likely that many people would not be able to utilise visits to the window. The hospital took no steps to facilitate that.
No.
I know it sounds obscure, but there is a point to the question.
No, there was no, and it was, there was no further steps.
No, very good, thank you. And thank you in general.
Thank you, my lord, yes. Thank you very much, Mrs. Ford.
Thank you.
Thank you, Dr. Ford.
She insisted on Mrs.
Oh, did you? Beg your pardon then, Mrs.
I wasn't talking down.
No. Very good. Shall we say just before the half hour? Very good. Thank you. Right, now, Ms. Bramley.
My Lord, the next witness is Marion Reynolds. Her statement reference for the record is SCI WT 0632 501.
Thank you.
Thank you.
Now, Ms. Reynolds, please take a seat. Thank you. Ms. Barami.
Thank you, my Lord. Good morning, Miss Reynolds.
Morning.
Please, could you confirm your full name?
Marion Reynolds.
Thank you. And your details are known to the inquiry.
Yes.
Now, there is a restriction order in place, so while you are able to mention the names of institutions, care homes and hospitals, please don't mention the names of any individuals. Okay, thank you. Now, you're currently a sheltered housing manager, but you are a trained nurse and you previously worked for the NHS and the private health sector.
That's right.
Thank you. You've provided a statement to the inquiry about your auntie who was an inpatient in Bo'ness Hospital before being transferred to a care home.
Yes.
Is that right? And about your mother who was residing at home prior to being transferred to Bo'ness Hospital.
Yes.
Thank you. Now, your auntie is now 95 years old, is that correct? Yes. But your mother sadly passed away when she was 89 years old during the pandemic. Thank you. You were your auntie's main carer prior to her being admitted to the hospital, is that correct? And that was in June 2019. And that was after she was designated as an adult without capacity.
Yes, she'd had a fall, and then after the fall, she was assessed.
Okay, thank you. Could you please tell us what an adult without capacity means?
Yes. The assessing mental health officer explained that my auntie could make a lot of decisions for herself. Some of the decisions that she was making made her very vulnerable. So it was decided that she was unable to go home, but she still knew her own mind. She was just decisions like giving the gardener her bank card, for example, to go get her some money out, you know, things like that. So it was decided that, and she wasn't eating properly, so. But it did not mean that she was unable to make any decision, and that was made very clear to me when I was going through with the guardianship, that she still had her own, knew what she wanted, and I should respect that as a guardian.
Yeah, thank you. And you said that as you were going through the guardianship, is that why she was in hospital rather than a care home at that point?
Yes, she'd never put power of attorney in place with it. She didn't believe in that sort of thing. So therefore, I mean, it's a very long process actually to take away someone's rights, even my little rights. It's a very long legal process, and quite rightly so. So therefore, I had to go through. She had to have a medical assessment, she had to have the mental health officer assessment, social assessment. I was assessed as suitable, and my family were all sort of involved in it as well. Did they think I was suitable? My husband was interviewed at home by the mental health officer as well. It's a very lengthy process to make sure that I would do the right thing by my auntie. And in the meantime, because she couldn't go home, she was in hospital.
Thank you. And prior to the pandemic, how often did you visit your auntie in hospital?
Every day.
Okay. And did anyone else visit her?
Yes, my daughter dropped in occasionally. My sister, she would drop in about weekly. My mum was not able to. At that stage, she was bad backache, so she couldn't get there.
Thank And was your mum, was your auntie in a shared bay, or was she in a room by herself?
She was in a room by herself.
Okay, thank you. Now, you say in paragraph 14 of your statement that you visited your aunt on the 20th of March 2020. This was just before lockdown, the official lockdown, and you noticed something unusual. Can you tell us about that, please?
Yes. Normally I would have just walked in the hospital door and knew where Auntie was, but there was a bit of a delay, kerfuffle, and I was kept in the foyer until a family unit got in before me, and it was very obvious they were getting made to not gown up, aprons on, gloves on, masks on, and they were actually visiting the person next door to my auntie, because they're very small rooms and very close together, so they went in to see this person in bed, and I went into auntie.
Okay, thank you. Now, when you went in the next day, what was going on then? What did you see?
Well, actually, so I'd done my visit to Auntie that day as usual, although she was quite agitated. There was a lot of activity next door and she was quite, what's going on? And of course I just got the washing, which I did every day, and I left. And I went back the next day for my usual visit, and there was a sign on the door, closed to visitors.
Okay. And when you saw that sign, I take it you weren't able to go past
I wasn't actually the only one standing outside the door. We were all sort of looking confused, and we managed to beckon a nurse across, who just says no, and wouldn't let me drop off my washing or anything, just no, sort of in that. And we did ask why, and she just went, can't say, sort of thing.
So we've heard from people that they were watching the news and seeing images from other places. Were you watching news and seeing?
Yes, and I was sure it was COVID, and
What impression did that create for you, not being allowed to go into the hospital and finding out in that way?
Actually, it was quite scary because, I mean, no one had phoned me. I mean, I was the point of contact for Auntie. No one phoned and says, look, sorry, we're unable to cater for visitors or anything like that. I didn't know when I would get back in, and I was aware of what happened the day before and how close this person was to my auntie. So I was, and this was, we'd all read it seen it on the news and things. You know, this was a really scary, horrible virus, and she was close.
And at that point, the rest of the country wasn't in lockdown, but within a few days.
Stage we'd been told to minimise movement, only go to work if you have to, that sort of thing.
Yeah. And then on the 23rd, we did go into lockdown. At the end of March 2020, you received a call from a hospital nurse, I believe.
I think it was a nurse. Yes.
Yeah. And she was asking you to agree a DNA CPR order for your aunt. Is that correct? Now, as a nurse, you know that a DNA CPR order, or do not attempt cardiopulmonary resuscitation, is about CPR. That being in place shouldn't prevent other forms of treatment. Is that correct?
It's like an awful lot of things. It depends on the interpretation of the person reading it. So,
in principle, it shouldn't. Is that correct?
Yes.
But in practice,
I, for whatever reason, I felt I wanted to be really clear, because I mean, I wasn't even power of attorney. I had no say. I shouldn't really have been saying, sure, put a do not resusc on my auntie. So I wanted to make it clear, still thinking about what the mental health officer who had assessed her had said, you know.
Yeah.
So I tried to tell them what my auntie's wishes would have been. And, you know, so, and I was trying to put that across.
Yeah. And what were those wishes?
Well, I mean, Auntie loved science. So she actually worked in the ICI and what have you. So she knew about antibiotics. She thought medicine was a fascinating thing. So she would want, for example, antibiotics and oxygen and care and comfort. But also, I think, I mean, she had the attitude that when it's my time, it's my time.
Yeah.
You know, so, I was trying to put that across to them.
Yeah. And how did the conversation with the nurse go?
I know you shouldn't, you know, when you're on the end of the phone, you don't really see how the reaction at the other end, but when you're hearing, you know, as I'm babbling away, I do talk a lot.
So you heard the nurse sigh?
Yes, and then, you know, sort of, well, that wasn't what I was asking, and I just said, well, that's all I can give, because I don't actually have that say.
Yeah. Did you feel like you were being a nuisance on the phone to the nurse, that's how she viewed you?
Of course, looking at the news again, and the picture in your head is these poor people are really, really busy, and I'm just being annoying. So, yeah.
But for you, it was important that you convey your aunt's wishes. And and so, at the end of that conversation, did you confirm that DNA CPR should be placed?
There was a confirmation.
Okay.
No.
So it was just left.
So I never ever knew whether they took from that conversation and put a wee sticker on a note saying, don't.
Thank you. And later the same day, you received another call from a social worker this time.
Yes.
Yes. But it wasn't your auntie's usual social worker
that I'd been speaking to, no.
Yeah. Thank you. Could you tell us about that conversation, please?
Yes. So, of course, this particular person told me about how they were freeing up hospital beds and they had managed to find Auntie a place in a nursing home in Erith. And, I mean, that's quite a distance from where we are. So I'd said it was quite a distance from where we are. You know, she can't put her there. Of course, all the guardianship was working towards her going into a care home eventually. That was the goal and her wish, but not that one. And I tried to explain, Auntie's not to leave Bo'ness. No. So I explained that, but I was told that it wasn't up to me. And I was saying, well, it's so far for us. Well, you'll not be able to see her anyway, was this sort of retort. And I was left sort of just with the information she was going to get moved. Okay.
What did you think of being told that it doesn't matter that you're distant from her? You won't be able to visit anyway. How did that?
Gutted, actually. You know, I mean, and Auntie was in that limbo stage where, if you like, because the guardianship was in place while in hospital, she actually had very little say in what was to happen to her, and we had no say in what was to happen to her. And I mean, I've loved that woman all my life, and very much so care. My mum, it was really hard to say to my mum that she was going to get moved out of Bo'ness, because the two of them had been taken away as children when the mother wasn't able to look after them. They were very, very young, and they were put in a children's home, and it was really quite awful experience, really quite cruel and abusive. And they didn't get out of there until my auntie could show that she was able to look after them. So we as a family knew that this would be devastating for her to go into any form of institution without her support, and would really, well, torment my mum. It did.
Okay. So because of the previous experience that they'd had, you felt that having no say and having authority figures essentially make decisions for them was particularly impactful.
Oh yes, but then they didn't know what the family knew, if you like, I suppose, you know, to... Yeah.
But because of that, you felt quite protective.
They were going through a process. They were clearing beds.
Was that, did you feel a responsibility?
Yes,
Was that traumatic for you, not being able to?
Yes, I knew that knowing that Auntie had to go into a care home, and knowing that was really against her wishes, she was never going into an institution again in her life. And she avoided doctors and all sorts all her life. because I mean, she really had no trust at all in any form of authority. And we knew it would be hard when she did move into the care home of her choice. Mm-hmm. But we envisaged that we were going to make it, going to help her through it, be there for her. And that was just not going to happen. And not only that, it would have you know, she would have been taken out of the town, taken away. Mm-hmm.
Thank you.
Again.
Yeah. Now, after these phone calls, did you receive any follow-up letters, emails, text messages confirming what had been discussed and agreed or not agreed? Were you given any contact details for the nurse who called you or for the social worker in case you wanted to discuss it?
I had email for the previous, our named social worker, but no, I hadn't been given any new information.
Okay, thank you.
So we were really actually just waiting on the phone call to say that's her on her way to.
Yeah, thank you. Okay, so your aunt's 92nd birthday was on the 2nd of April 2020.
Yeah.
That was quite early on in the pandemic.
Yes.
Did you try to visit her?
I did. We weren't allowed to visit at that stage, but she was on the ground floor. Mm-hmm. And when I had been visiting, I used to wave to her at the window and things. So I of course, through my job, I was an essential worker. So I had that letter that says it was all right for me to go where I like. Well, go to work, and I set off. And my auntie's deaf, and her eyesight's not good. She used to lip read, but her eyesight. So what I did was I wrote all these various cards saying, you know, sort of just things like happy birthday, Mum's doing all right, we all love you, we're missing you, this isn't for, you know, just things so that I could have a conversation through the glass. So when I arrived at the hospital, I noticed it was actually like someone had died in the hospital because there were so many flowers and things just sitting outside the door. So they were obviously not taking deliveries. So, I mean, Auntie's flowers were there with cards. You know, they were obviously not letting the postman in.
Were those flowers that family had sent?
I sent flowers, but obviously other people's families had been sending flowers, so it was sitting a bit like those scenes that you see at a roadside if there's been an accident. So I went round to Auntie's window and there was someone else in her bed. Well, her room, what was her room. So I phoned and the nurse said, oh no, we've moved her up the stairs. And I went, all right, okay. And they said, it's all right, just go round the side and you'll see her. So I went round the side, but it was on a slope, so really I couldn't barely see what window they were. And I actually could hear her better than I could see her. She actually didn't look well at that time. And she was just crying out, what are you doing to me? Where am I going? What is it? I can't see anything. And I was sort of standing lower, shaking my hands and saying, no, stop it. I felt awful. I'd done that to her. I did that. I was being totally selfish. I wanted to see her, and I'd done that.
Yeah. What did you do at that point?
I actually just sat in my car till I could pull myself together. And then I had to go home. And of course, being me, I told the family what I planned to do, and you know, and I had to report. I wasn't, you know. Yeah.
Thank you. Now, the next night you received a phone call.
Yes, it was quite late.
Yeah. And they were advising you that your aunt had tested positive for COVID.
No, they phoned and said that Auntie hadn't been well.
Okay.
And that she'd had a day in bed. And I said, can I come down? And they actually said, no, it's all right, you know. And I wasn't allowed to go, you know, no visitors at the moment. So.
Okay. Did they tell you how poorly she was?
No, they said that she'd had a day in bed. Okay. And of course I phoned the next morning and she was still in bed, but she took some sips of whatever. the usual sort of thing you get when you phone hospitals.
Yeah.
And then we found out that we got another phone call, I think it might have been 2 days after that, to say that she had COVID.
All right, okay. And at that point, you say in paragraph 34 of your statement that you found out she wouldn't be going to Earth as she had COVID, but they told you she was fine for the moment. Yeah. Is that right? And then, excuse me, in paragraph 35, you then mention that you were told later, you were told something that contradicted that. Could you tell us?
Yes, yes. The town I live in is not very large, and where I work, one of the nurses who was visiting their relative in the place I work was also, so we're very friendly. And it was much, much later after, you know, things were sort of getting back to normal. I actually met her in Tesco's, and we had, she was, you know, how's your aunt? And we were talking, and she'd said that that night they didn't think that she was going to make it. The night I got the phone call.
What did you think when you heard that?
Unbelievable. I said to her, you know, I actually said, we were never told, we never knew that at all.
Did you feel you could build a relationship of trust, given?
No. At that stage, I think I'd sort of, anyway, you know, by the time, when I got told that by that nurse, I thought I'd got over, I mean, I'd actually passed trusting, I'd probably a bit like my auntie, not trusting authority as much.
So your trust had already been affected?
At the time I heard that. Yeah. At the time they told me that auntie had just had a day in bed, I actually thought that everything that you told a relative was honest. Yeah.
And then in paragraph 42, you tell us that you then saw them administer a COVID test to your aunt.
Yes, by that time I had guardianship and she had a place in a care home, so she had to be COVID free to move to the care home because. And I was allowed in to visit her at this stage as well. We were allowed half-hourly visits at that stage. So when I went, when I went in, I could hear. She was actually in the dining room, and I could hear her shouting her head off. And you know, when I followed the voice and went into the dining room, the nurse says, "Oh, you could maybe help us." And I just went, "I'm not going to help you with that," because Auntie was sitting. She was sitting in a dining room chair that had arms, and there was a nurse either side, kindly holding her hands. But someone was trying to do the COVID test, and she wasn't having a bar of it. And,
when you say kindly holding her hands, were they holding her hands for support, or were they restraining her?
Well, I would say it was restraint, but you know, they were holding her hands. They weren't holding her down. Yeah. They were holding her hands, so she was sort of trying to avoid this thing going up her nose.
Yeah. And you say in paragraph 42 of your statement that she could have done the test herself.
Yes. And that was something when she did move into the care home, I said, please allow her to. I mean, sticking a swab up your nose is not that beyond most of us. I mean, even if you are an adult without capacity, she could follow instructions and she could do it. Yeah. Yes.
So did that further affect your impression of the the staff?
But that's, yes. Having to have 2 clear COVID tests was just another one of these things that I felt that staff had to tick that box, get that done. Yes. Yeah. So, yeah. It helped in a tiny little way because Auntie, who never wanted into a care home, did announce to me that day, get me out of here. And I had this sort of conversation that went along. Does it matter where? I think I've got a place. So it's sort of, yeah.
Thank you. Now, your auntie did recover from COVID at that point.
Yes.
And you were able to see her.
That was before the care home COVID test. Yes, she recovered from COVID. Yes, amazingly.
Yeah. And you were able to visit her. How did the hospital
started to open up visiting, I think it was sometime in May, maybe the end of May, and it was, you had to say when you want, you know, can I book up an appointment? And you had half an hour.
Okay, thank you. And where did the visits take place?
In Auntie's, but this time they'd moved her back downstairs in the hospital, and so she had a private room again. So yes.
And sorry, was that in her room the
In her
visits
room,
took place?
yes.
Were you the only one who could visit?
Yes, it was only one person.
And you told us at the start that you were obtaining a guardianship order. Was it in August that year that came into effect? You were able to obtain that?
July.
Okay. And then at that point you were able to choose a care home?
Yes,
Yep.
yes.
How did you make the decision of which care home to choose?
Well, locality, because she would be able to stay in the town that she was born in, which was her wishes. And also, I had once worked in that care home. I had visited people in that care home, so I knew what the setup was.
Okay, thank you. And did you take your auntie's possessions to the care home when she was moving in?
The stuff that she had, she and her stuff from the hospital went without us. We were allowed to drop some stuff off. My husband and I picked up her telly, some ornaments, bits and pieces, and handed them over to the care home manager in the car park.
Okay. And what did the manager do with them? Was he able to take them straight to her room?
No, they had to be quarantined for whatever length of time they were quarantining things.
Thank you. Were you able to visit your auntie in the care home?
No. She had to have 14 days isolation within her room, but we weren't allowed to visit her even after that.
Okay, not
so
even outside?
I didn't know what her room was like. I didn't know where her room was, or...
Okay. After the isolation period, was it a 14-day isolation period? Were you then, did there come a point where you were able to visit her?
No, not at first. I didn't. It was, I'm trying to think, it was in autumn. It was in, I think, September when I was first allowed a garden visit.
Okay. Could we go to paragraph 44 of your statement, please? Sorry. Paragraph 45.
Yes.
Here you mentioned that garden visits started, but the rest of the country were eating out to help out. I think that started in August 2020.
Yes.
Could that be correct?
I think it was September when I actually got to do the garden visit.
Okay, so your garden visit started in
Yes.
September. Were you the only one again who could visit?
Yes.
Okay, and you mentioned that the rest of the country were able to take part in the Eat Out to Help Out scheme, but your aunt could only have a visit from one person.
That's right.
What did you think of that?
I'll be honest, when I got the call from the care home to say that I was allowed to visit Auntie, albeit a garden visit, I'll be honest, I just cried and cried. The woman got no sense of me. It was the most exciting thing being able to see her. But there was also, if you like, a little bit of anger within myself. The place where I work, all my clients were shielding, but they were not locked away. So I did think, it was a bit ridiculous that we were still having to see people in gardens. Yes, I think I was angry in some respects and delighted in others.
What form did the garden visits take? Were you actually sitting in the garden?
Well, there was a bandstand.
Okay.
Yes, so I had a bandstand, and when I arrived, I had to ring the door, and I had to go and hand sanitise, put a mask on. There was a chair for myself, and then Auntie would be wheeled, complaining, in a wheelchair, and put at the other end of the bandstand, and the care staff sat in between.
Okay. And how did those visits go? How did you find them? How did your auntie find them?
It was lovely to see her. it was lovely to look at her. But they were pretty unsatisfactory from her point of view because she couldn't, like I say, we talked with whiteboards or notes. So I had brought my whiteboard, but the distance between us, she couldn't see and I couldn't write big enough. It was like one word at a time. And of course she's, come on, you know, trying to beckon me across. I later, the garden visits, I'd given a whiteboard and asked, although it wasn't always brought with her, so at least if the carer could write down what I was saying and show it to Auntie a bit closer, it would have made it a bit, but it was very
Did that happen?
Yes, I did leave the whiteboard, and sometimes the carer remembered to bring it with her. So yes, but no, it was...
Did you attempt any online visits with your auntie?
She could not have... I didn't know if they had Wi-Fi there or anything anyway, but Auntie would not have been able to communicate on Zoom or anything like that.
Did you try other contact methods?
With Auntie?
Yes.
No, she's deaf.
You mentioned letter writing and notes.
Yes. That was... Auntie had, in 2020, early dementia, and I was very aware of what that involves, and it was trying to keep her memory. And when she was in hospital, I was, you know, all our conversations was around the family tree and prompting her back to and making her memory recall and reminding her of people in the family. So on a daily basis, I was writing her letters. Just even if it was just little notes or postcards or cards or something, or telling her when it was my granddaughter's birthday, I would put in wee photographs and things. Just so I did that, yes.
Thank you. Now, after a while, for a brief period, other members of family could visit.
Yes.
Is that right? Until that completely stopped in October 2020.
Yes, there was an outbreak in the care home. So
apologies.
there was an outbreak in the care home, so we weren't able to visit.
Okay. Were you able to have closed window visits at that point?
When there was an outbreak in the care home, even window visits weren't allowed.
Okay.
Because I distinctly remember the conversation I had with the nurse who phoned up and told me that it was closed, and I was like, oh. But this time I knew that Auntie was on the ground floor again. So my great idea is, I'll just go to the window. No, that's not allowed. And I think I say in my statement, I got really quite cheeky then. I said, look, can it go through glass now? I mean, come on. When the care home opened up again, but not to us, and the weather was getting worse, we were allowed window visits, and I had 2 or 3 of those, but that was also fairly unsatisfactory because Auntie would just come in, go round, come in. And at one point I took my daughter and my granddaughter and got told it was only one person at the window.
Did you ever try to challenge the procedures and rules?
Yes. I usually by telephone and usually through my typical sarcasm. But I didn't, although I was familiar with the care home, having visited it before, I didn't know the staff. I didn't know who was looking after Auntie. I do now, they're lovely. But at that time, I didn't know how kind they were. I had no relationship with the staff other than phone calls and an official relationship. So you really don't want to become that difficult person and have her tagged with the one, she's the one with the difficult relative. So yes, I would challenge, but so far.
Okay, were you worried about the effect on her care?
Well, yes, and I know that's probably not a good way to think, but you know.
Thank you. Now, that Christmas, were you able to see your auntie?
No.
Okay. What impact did that have on you? Were you used to being around each other at Christmas?
Auntie was always part of Christmas, always, from when I was, you know, and when I became an adult, for whichever reason, maybe I was being selfish with my brothers and my sister, but I always had auntie and mum at my house, and my kids were used to auntie and mum at my house. When auntie became frailer and couldn't go to my house before she ended up in hospital, we had this sort of ritual with me and all the family. We'd take a tray in with a course on it and things, and we'd visit her in her home. So auntie was a huge part of Christmas, huge. And we weren't allowed to see her.
Do you know if that had an effect on your auntie?
It probably would have. But I don't know for definite, because at that particular time we were heading for a lockdown and I didn't see her for well over a month.
Thank you.
So I don't know how she received her presents, because we dropped those off. They had to be quarantined. There was no pictures from the care home of auntie opening Christmas or auntie sitting with a Christmas hat on or pulling a cracker. The care home didn't do that. So I've got no idea how her Christmas was.
Did that play on your mind quite a bit?
It was also at that, like I say, I mean, I'm used to family Christmases, and we were allowed one bubble person. So choosing a member of your family, but my daughter, she lived alone, so she came to us. So that was a very, yes, empty Christmas table, just me, my husband and my daughter.
Thank you. Now, turning to your mother, in 2020, your mother was living at home, is that
Yes,
correct? How was her health at that point, early in the year?
My mum, mentally, she was quite bright most of the time. She did not have dementia. She had been in and out of hospital for the best part of 2 years, in and out and in and out, with what was always diagnosed as chronic back pain or constipation or things. There was days that she couldn't get out of bed and stuff, so or she would fall. But she didn't spend long periods in hospital. She was always sent home really quickly with some other painkiller, patches for her back and all these sort of things.
Did she have anyone assisting her with her care at home?
Eventually because of course the assumption by the GP and the doctors and things was Mum wasn't taking her painkillers, so we had carers going in to prompt her meds. My older brother, he took up the bulk of being with my mother, you know, so he spent most of every day with my mother, made sure she had her hot meal at meal times. I would visit after my work and give him a break, you know, and I was sort of the my brother used to say, I don't do naked mother, so I was the one that did the sponge baths and things like that. So yeah, so between the two of us.
Thank you. Did your mother's health deteriorate during the pandemic?
Yes. It had been deteriorating over the 2 years, and we had pointed out things like weight loss and things, but apparently we can lose weight in old age. I'm looking forward to it. Yes, so it was always, but yes, her health really deteriorated very quickly, very quickly.
Did you, in July 2020, receive a phone call from one of the carers, your mum? What did they tell you?
The carer had called me at my work and just said that, your mum's really not well, we're very concerned, can you come? And I did.
Yeah.
Yes.
And did you contact her GP at that point?
Yes, immediately, yeah.
What did the GP do?
Actually, the GP, well, once you got past the receptionist saying, you know, can you do a telephone? No, and I was quite, you know, please, I need a home visit, my mum's not well. And they came down about 2.5 hours later.
Okay. Then, so what happened after that, after the GP came out?
Well, my mum had actually, my mum was not, she was sitting in her comfy chair, but she was not responding to me and my dad. I'd phoned my brothers and sister and that, but my brother had come down. She wasn't responding to us, she wasn't answering. She'd, you know, we were asking her lots and lots of questions. Are you in pain? Can you move? You know, trying to give her drinks and things. The doctor came down, took some bloods, asked me and my brother if we could manage, but it was so very obvious this was not either constipation or backache. There was something far seriously wrong with my mum. She was not even responding with her eyes. You know, when you spoke to her, she wasn't looking towards you. So there was something very, very serious, and the doctor arranged for her to get taken to hospital.
And at hospital, she had some tests carried out, is that right? And she was admitted as an inpatient. It wasn't just a case of tests and being sent home.
She was admitted.
Were you able to visit her there?
No, well, no, that's not true. Once again, one visitor, half an hour, booked. And my sister visited my mum once a day.
Did you know about, at that point, essential visits?
No, it was never, I didn't know, and it was never suggested.
Okay. Then, on her third day in hospital,
Yes.
you say you got a call from her consultant.
Yes, actually, my older brother was her next of kin, so he'd got a call. But the consultant called me because I believe my older brother just went to pieces on the phone.
Okay.
So he then phoned me. Yes.
Are you able to tell us what the consultant told you was
Right.
the issue?
Yes, my mum had pancreatic cancer, and it had spread through most of her major organs, and she would have possibly 2 weeks at most.
Okay. Had this been going on for a while then, but nobody had known?
I think so. Yes, I think that was what all the going into hospital was over the past. You know, this backache that got increasingly worse. Yes.
How did you feel at that point? You know, over years having been sent home, and at this point you can't visit,
Yeah,
and you were given that news.
At that point, I was just overwhelmed with the news. Latterly, I'm actually really quite angry, but I do actually say in my statement, and it's probably a bit naughty, but I am a sheltered housing manager, and I don't think that the over 75s get treated or have as much tests and treatment. And nothing will convince me otherwise.
Okay, thank you. Did you ask for your aunt to be discharged so she could return home for end-of-life care?
My mum.
Oh, sorry, your mum,
Yes.
apologies.
Well, that was on that conversation, you know. So my mum's going to die, and very soon. So I asked to get her home. And I remember begging with this man who actually says, no, you can't. And he explained that she would need round-the-clock care. Well, I mean, she had 4 kids, she had grandchildren. Round-the-clock care would not have been a problem. I just wanted her home. And he says, no, you would not be able to manage. And I got really, really quite angry, telling him that he didn't know what we could do, what I was capable of.
Did he know that you were a trained nurse?
No. But then, I mean, yeah. But no, I mean, they weren't going to make my mum better. So why was she in hospital?
Mm-hmm.
My brother and I had already moved our bed downstairs. I know that my work would have been really quite good with giving me however long I needed. There was no reason, there was no medical intervention that she actually needed other than pain relief. Mm-hmm. So I was actually quite angry. However, through my anger, I managed to persuade him to move her into the same hospital as my mum, as my auntie.
And did you hope that they'd be able to see each other in that hospital?
Yeah.
Once your mum was moved to Bowness Hospital, you weren't allowed to visit her,
No.
were you?
No.
Why was that?
Because, well, we were told that it was one visitor, one named visitor. We weren't allowed to, perhaps my brother one day, me the next, or anything. And they also, I couldn't be because I was the named visitor for my auntie.
Okay.
And I couldn't visit my aunt and my mother.
So your brother, you mentioned, became the named visitor for your mother, and you became the named visitor for your auntie.
Yes.
And even though your mother was at the end of her life at that point, a doctor had confirmed that to you, they didn't give you essential visitor status, so you could be with her. You said before you weren't aware of that. Okay.
It was never
suggested. It was never raised, and you weren't aware that that was a possibility.
I didn't know. Out with a COVID situation, I would have probably have insisted, but we were living in very strange times, and it was only July, the beginning of the pandemic. So I was taking my guidance from what the hospital was telling me I was allowed and not allowed to do, and she was only allowed one visitor for half an hour.
Yeah. I suppose, you're saying you were taking your guidance from the hospital.
Yes.
Did you think that if anything else was possible that they would tell you?
Well, but yes, of course.
And you mentioned that you'd hoped that your mum and aunt would be able to see each other being in the same hospital. Yeah. Did that transpire to be the case?
They were not allowed. Same lady as I spoke to in Tesco's that day, Auntie did see my mum. They found her in my mum's room. Well, the night staff found her in my mum's room, just watching her.
Okay. I take it that hadn't been arranged by the staff.
No.
She just made her own way to her sister.
Went for a walk.
Did that make you feel slightly better about the situation? Now, while this was going on, you got some other news as well. Is that correct, from police in Edinburgh?
Yeah. Actually, my ex-husband lived in Edinburgh, lived alone. He wasn't well, and he was getting carers in, but he hadn't been answering his phone. And of course, although we were working and things, you weren't allowed to travel between places. So my son and my daughter hadn't heard from him, and they were getting increasingly concerned. And so I'd actually said to my daughter, if you're really concerned, why don't you phone the police? And she did. And I got a phone call. The day my mum moved to Bowness Hospital, I got a phone call from Edinburgh Police to say that they were with my daughter in Bowness, and I just went there. He was found dead. So
at that point, the impact in terms of the impact on you, you were having to think about your mum, your auntie, and now you were having to think about your children's mental health and how to support them.
Yeah.
How did you feel?
There was a real unreality about the whole situation we suddenly found ourselves in. It was, my children especially, I'm their mother, but they just lost their gran and their father. It was only a few days after that my mum died. So they were coping with that. I wasn't, because we were still not allowed to hug and be out with our, groups and stay, 2 metre distances and things. How do you comfort other members of the family and my kids?
Did you feel that you had any support? Was anyone supporting you?
I had my husband.
Okay,
He's been brilliant.
thank you. Did these events affect your relationship with your family, with your siblings, with your children? And
It was a few months after that, it was kind of obvious that things were breaking down. There was so many questions that had to be answered. I was, probably because of my background, I was always the one that made the phone calls to hospital, made the phone calls to care home, made the arrangements, took on the bulk of the care and things like that. And there was a lot of frustration on my part and on their part when I was telling them what the rules were. No, I'm not allowed to do these things and that and that.
who were you telling these things to?
I would keep in touch with the rest of the family, mostly through phone, text and whatever like that, My younger brother was particularly upset. He was living in England, so he couldn't travel up until the very last minute with my mum. So he had to rely on what I was telling him on the phone. And of course, as you do, he was challenging me all the time. Well, ring them up, Maximus, or why can't you do this? And it was just
Another pressure.
It was beginning to get really quite tense between us.
Okay. Now, so it was July that you found out about your mother's condition, and later the same month, you were finally told that the whole family could visit her. Is that correct?
Yes. It was. She was only in the Bowness Hospital a couple of days, and we did get the phone call that said that they were now open to visitors. So, so I went in, and my sister came and took the sort of next shift, because we were actually, there was, when we went into the hospital, the staff stayed away from us. Obviously COVID, although we'd scrubbed up and things, so we weren't quite sure whether we could all be in together or not all in together. There was always that. So I'd gone in, and my sister came down later on, and then I went down at 2:00 in the morning and spent the rest of that night. I'd sort of had a wee bit of sleep, and I spent the rest of that night. My daughter pitched up at 9:00 in the morning to let me go to work, just to check up on them and freshen up. And then I went back up, and then my brother had managed to get up from England with his wife and daughter, thank goodness, and they went in with my other brother, and that was our last. Okay.
And on you mention at paragraph 70 that the same day Falkirk Sheriff Court granted your guardianship order of your auntie. And then you say, odd thing to think about her say, but I became an orphan, adopted an aunt, and my ex-husband and mother lay in the same undertaker's parlour on 21st of July 2020.
Yeah. And you're asking how I felt and things. I think perhaps that paragraph indicates the sort of mad thoughts you're having. I mean, COVID didn't... my mum would have died anyway. I'm guessing my ex-husband would have died anyway. I would have got guardianship, and Auntie would have moved into a care home. But the restrictions and what we went, one, there was all this big impact, all this happened at once. But although, like I say, I had my husband, we weren't allowed to be together as a family because of the COVID restrictions, and support each other at all during that time. So I was having my thoughts like that, actually, in my head. Well, I've adopted an aunt and I'm an orphan, and you begin to get a little bit crazy.
And you're quite sleep deprived as well by this point.
Yeah.
What was the impact of all this on you and your family? All these things happening at once.
Yes, my immediate family, if you like, my children and my husband and that were still very, very close, and I'm not so close to my brothers and my sister, and one brother in particular I probably will never see again. Just too much misunderstandings. I'll be honest, it's probably as much my doing. I knew that I was becoming unwell with the whole thing. I knew I had to do all the guardianship stuff that was required for my auntie and close up her house and things, now that I had the certificate. So I just stepped back and dealt with my own individual units, you know, my kids and myself. And that distance, I think, was probably as damaging as what had happened.
Thank you. Now, your aunt is still in a care home?
Yes.
In the same care home. You say in your statement at paragraph 81 that you feel like you won a reward as you can see her now. Can you tell us about that?
As I say in the paragraph, I stuck to every rule and ridiculous request, and the requests were really quite ridiculous sometimes. From when we were allowed indoor visits, for example, I had envisaged that I would be in Auntie's room, albeit for half an hour. I'd get to see the room at last where she lived. That wasn't the case. So it was lateral flow test, wait in the car park for result. And then I had to go round the back of the building and up a metal in a door and up a metal staircase. Goodness knows how frail elderly people managed it, if they did at all, into an empty room where the bed wasn't even made, you know. And Auntie would be sitting at the window and there'd be a chair for me at the door. And that was what the visit was like. So I was back, you know, I was still doing that. Yes. So, yes, so we got through all that. Eventually she was allowed more people to visit her, but it was time slots, you know, and you had to fit in with the time slots of every other person going into that care home. Still had to, in fact, we were still doing lateral flow tests right up until at least summer 2022. We were still having to do lateral flow tests, albeit not waiting in the car park for a result to be allowed in for half an hour. Eventually we were sort of, and at the end of it, I've still got Auntie.
Thank you.
So it's a reward.
Yeah. Now, you mentioned that your auntie was in the early stages of dementia in 2020. Yes. Was there ever, you know, that's roundabout when at the same time as the pandemic started, was there ever any intervention or therapy put in place to help with her symptoms? No, I would say that recently there has been more by way of activities and things within the care home that I've become aware of. Yeah. It was a long time before we were allowed to see what was actually functioning in the rest of the care home, but meaningful activities I only became aware of in the past year. Okay. Do you think that not having intervention early on has impacted your auntie?
Absolutely.
What's she like now?
I say in my statement, we were all quite prepared for it to forget us. That's part of it. But what made Auntie feisty, and how to explain it? I didn't expect her to forget who she was. Auntie and it's back to her childhood. She wasn't someone who would put out their hand and hold your hand. She had nothing to do with hugs and cuddles. She was very, very private with her person. So, you know, if I had gone up to Auntie pre-pandemic to try and give her a hug, she would have reacted rather than by, get away, stop that nonsense. whereas she's passive. Auntie was never passive, she's very passive. I sometimes see her self, but I would say she's passive. She allows intimacy. This lady has never allowed intimacy in her life, so that really surprises me.
Okay, thank you. I'd like to move on to the lessons learned that you have put in. Now, we have everything that that's in your statement, and we will take all of that into consideration. But I want to look at one particular point that you've raised there. Please, could you read paragraph 85?
Yes. My place of work is not covered by the Care Commission. It's very similar to care homes with common rooms and corridors. Where we have flats, they have rooms. People would come in and out, and we would manage it quickly and effectively. We would think outside the box and develop 2-metre distancing, one-way system, passing places, implemented temporary barriers across doors. My residents were not micromanaged, and things became possible. Why couldn't this have been done in care homes?
Thank you. Now, can you tell us how many residents were in your building?
Yes, there's 23 flats, and it's actually really similar to where my auntie is. In that there's sort of the main reception area, myself. Common corridors. We don't provide meals, obviously, because it's independent flats. But all the flats run off the common corridors. We have a common room, which we use for coffee mornings, bingo, the keep fit, that sort of thing, a wee kitchen that we do that in. There's a common laundry that the residents use and carers use, and we have a guest flat for anybody that's got visitors and things that might wish to use it. So my residents, because we don't have, there's only 2 staff at my work, myself and my cleaner, so we can't say, no, you can't have your home carer coming in, because every single one of my residents are in the shielding category. Just by their age alone. Some of them were very dependent on home carers. Now, you can't just lock doors. But we managed to manage that. We had to lock the common room because we followed Scottish Government guidelines. But the common room opened up when hospitality was allowed to open up. And so we rejigged it, made it less chairs, spaced them, made sure it was well ventilated, but we didn't say no.
So the residents had their home carers arrive.
Yes.
Did they ever have visitors?
Yes, yes. Yeah.
Was that outdoors or indoors?
Initially, if you just take it as an individual block of flats rather than, sheltered flats, it is a block of flats. So my residents are like other elderly people in the community. So just like my mum was and things. So yes, they're dependent on the visitors bringing them shopping, some of them. Some of them were receiving end-of-life care within their home.
Were there many outbreaks of COVID in that home?
The first time that any of my clients had COVID, an actual case of COVID, was July 2023.
Okay, so none.
And that's been the only one.
Okay.
So I guess I'm lucky.
Yeah. And being in sheltered housing, were they able to attend hospital during the pandemic if they became so poorly that they needed?
Absolutely.
So that was not closed off to them, despite their age, despite their shielding status?
Well, yes.
Yeah. Thank you. And if we could move on, please, to your hopes for the inquiry. Could you please read those 3 paragraphs?
Yes. My wish is that when this inquiry is finished, we must state that the frail and vulnerable should never have their human rights removed again. Just because they're vulnerable and have no voice, they did have a voice, they had us, but no one listened, so please listen now. Practices should be structured in how we can maintain their rights and dignity in the first instance while we protect. As COVID has proved, we must be ready, proactive and not reactive next time.
Thank you. Do you feel you've been listened to today?
I do.
And do you feel we've covered all the key points you wanted to raise? Okay, thank you very much. I don't have any further questions.
Yes, thank you very much, Mrs. Reynolds. Ms. Barami, or Mr. Gale for that matter, we've finished early. If you could arrange to start at 1:45, it would be helpful. I understand if you can't manage it, but if the witness is here, we should start at 1:45. Thank you all.
Thank you.